Finally, we would like to give you a few post-operative tips and tricks. Return to activity is always a little bit of a concern post-abdominal surgery. So we want to give you a few ideas about what you can do when. What's usually really interesting to think about is healing time. The body takes 3 months to really heal from beginning of the operation to the end point where everything's really knitted together nicely. But by the 6-week mark, you really are able to do quite a lot more. So within the first 6 weeks, we really want you to listen to your body and pace activities. We do want you to be moving, we want you to be walking. So start off walking around the house, and as you feel a little bit better, you're going to go a little bit further and a little bit faster with each day. Lifting is always a bit of an issue, and we don't want you to lift anything heavier than a full kettle in that first 6 weeks. So we need you to delegate the hoovering and delegate lifting the shopping, and really look after your body. Think about what you're doing. We want the pelvic floor muscle work that we've taught you and the gentle core stability exercises. Obviously, once that catheter's been removed, we want you to really get going with those. Use the NHS endorsed Squeezy app. It'll remind you to do those exercises 3 times a day. Listen to your body. Your body will tell you whether it's happy or not. So if you are uncomfortable, please take the analgesia. We want you to be moving around and walking. We don't want you to take to your bed. It's really important for recovery that you get up and about and move. Between 6 months and 3 months, you can start to increase the lower impact exercise. So you can start doing speedier walking, you can start cycling if you're comfortable on the perineum, and you could do a gentle exercise class. At the 3 months point, just as long as you've had no hiccups in your recovery, if you've had an infection or a problem with your wounds, then you might want to wait a little bit longer, but you can really get back to your normal exercises, your higher impact exercise, your normal lifting. Driving is always a bit of an issue for patients. When can I go back to driving? There isn't a hard and fast rule. You need to be comfortable wearing a seat belt, you need to be able to look behind you to see whether there's anything coming, and you need to be able to do an emergency stop if a little one runs in front of the car. And we would always advise that you double check with your insurance company just in case you have an accident and you have an issue there, so please contact them. Returning to work is always another question. When can I start again? Well, if you've got a sedentary job, then you should be able to go after that 6 weeks. But if you've got a more manual job with pushing and lifting and heaving, then you really are going to want to have the 3 months off work. So really think about what your job entails, and then you'll get that balance right. Our next slide gives you contact details for the gynaecology nurses, and also how to refer yourself to physiotherapy. So if you're having problems with your tummy or your pelvic floor exercises and you would like to see us at a later date, then you can self-refer yourself via the Adam Brooks website. You'll find a self-referral form on the website, or if you struggle with finding things on the website, you can just pop into physiotherapy and fill out a form behind the reception desk. The final slide gives you a few links to all sorts of resources which you might find helpful or useful, so please use those. And we'd just like to wish you all the best with your surgery and hope that you found this video helpful.